I want to start off a little bit today by just sharing about SBA, how it got started, and where we are and where we hope to be going in the future. So SBA, believe it or not, in 2023 will be 50 years old. And it was started by groups of local organizations that decided that they needed a national presence to really bring to light spina bifida. So lots of folks were working on the local level together and realized that they needed a national presence. And from that, the SBA, the Spina Bifida Association of America, was formed. And as you know now, we go by just Spina Bifida Association. But our legal name is of America, Inc. And so I know at least one person is on the webinar who's in a chapter, and it was one of the chapters that is actually older than SBA. So it started before SBA, and it was one of the ones that helped to found this organization. So for a long time, SBA kind of worked as a convener of local groups. That was really what the role of the Spina Bifida Association was. And things started changing in the 2000s when everybody realized that people were living longer with spina bifida, but we really didn't know that much about living with spina bifida. And in 2003, there was a research agenda meeting that occurred. And out of that meeting, there was a recommendation to start a registry. And that registry then began in earnest about 13 years ago now. And that is the National Spina Bifida Patient Registry that's located at the National Center on Birth Defects and Developmental Disabilities at CDC. So with that change, the organization started to change. And it really began to look at how it could become a leader and fighting for people with spina bifida. And that's kind of where we are today. So research, advocacy, education are all key components to what we do and how we try to improve the lives of people who live with spina bifida to build that better and brighter future for all. So that's a little bit about SBA. I want to start too by just sharing a little bit that we do have chapters. Those chapters, in some instances, are separately incorporated entities that have their own board of directors, their own legal determination by IRS, and they are joined by SBA with an affiliation agreement. And we also have a set of chapters that we started about 7 years ago that we call corporate chapters, and they fall under SBA's umbrella legally. So whereas our affiliated chapters have a connection to us through an affiliation agreement, they are not legally a part of SBA. These chapters are, and so those are located in the Carolinas, Southern California, the Intermountain region, and Michigan are four of the places that we have those chapters. And so, and the fifth is Georgia and Tennessee. So those chapters have a different relationship with us than those affiliated chapters that were the ones that actually helped to get SBA started. So that's a little bit of SBA History 101.
Yeah, that's a good thing to cover. A lot of people usually have questions about our chapters, and actually just heard one today. So we have a page on our website that also kind of highlights where all the chapter areas are, and the links to the directors for each of them so that you can reach out to them and get involved. Okay, Tim, can you hear me?
Yes.
Okay.
How about
great.
you?
Yes, we can hear you. So somebody asked this earlier when we were first advertising this webinar, that even as a person with spina bifida or someone impacted by spina bifida for that matter, family member, grandparent, sibling, whoever it is, they often have a hard time describing spina bifida to somebody who has like no knowledge or no background in the disability world whatsoever. So I was wondering if you could try to give an elevator pitch for what spina bifida is for people who might be completely unfamiliar with spina bifida in general.
You know, it's hard to give an elevator pitch, But what I would say is that spina bifida is a congenital birth defect of the spinal cord, of the nervous system, primarily the spinal cord, that causes nerve damage and can affect how people walk, can affect bladder and bowel function, might be affected by hydrocephalus, though not everybody with spina bifida has hydrocephalus. And it's really the damage to the nervous system that happens before birth that really causes all of these effects.
Yes, that's a good medical pitch. I'm sure many of you have also often heard people say it's the spine or snowflake condition. The snowflake condition is one we get questions about, as well as the most permanently disabling birth defect compatible with life. And compatible with life is just another way of saying that it's not a death sentence. You can still live and have spina bifida, which obviously many of us know. And the snowflake condition is because no two people impacted by spina bifida are the same. Did I get that right, Tim? Do you want to add anything?
Correct.
Okay.
No, I don't need that. Yeah.
Okay.
I think also to add is a lot of people, if you use spinal cord injury, a lot of times people can understand that because, you know, everybody kind of has an idea of what that means. So that's another helpful term.
That's right. You said you've used that one good in some elevator pitches, like a spinal cord injury at birth, right?
Mm-hmm.
Yeah. All right, Tim, I wanted, some people have asked questions early on, but I think this could be a question that we might be able to elaborate on a little bit. Jennifer asked a very specific question about the flu vaccine. And Jennifer, I'm sorry if I say this wrong, but she has concerns about the flu vaccine and the risk of Guillain-Barré with someone that has spina bifida. They've been debating about the flu vaccine. I guess, do you have any knowledge or advice to pass on to Jennifer?
So with the influenza vaccine, there is a very, very tiny risk of a condition called Guillain-Barré syndrome. And Guillain-Barré syndrome ends up being causing potentially some paralysis that starts in the legs and can move up. Most of the time people recover from Guillain-Barré, though not everybody does. The risk of Guillain-Barré is extraordinarily small. So I don't have the exact statistics from influenza, but certainly much less than 3 or 4, or it might be 3 or 4 out of a million. So the frequency is not very high. Individuals with spina bifida are not felt to be at increased risk of getting Guillain-Barré compared to other people. So the risk is very small, but it isn't zero. And there's no test that predicts who's going to get Guillain-Barré, unfortunately.
Okay, thank you. Hopefully that answered your question, Jennifer. We're happy to take very specific questions. So if you ever have specific questions where you can't ask it live, you can always contact our National Resource Center too, because our National Resource Center goes to Tim or our Associate Medical Director, Dr. Brad DiCiano, to ask those questions.
I will try to do a little research to figure out the exact incidence of Guillain-Barré, and then I'll pass that on to you.
Okay.
But it's very rare.
Okay. All right. Cool. Sarah, we have a question come in through our Facebook that I think you'll really like. Somebody asked if we have an updated number on Americans with spina bifida.
Not yet, but prior to this webinar, I was on the National Spina Bifida Patient Registry Coordinating Committee call, where they bring all the clinics together. And SB and the National Spina Bifida program is funding research that AUCD and the University of Minnesota are doing that hopefully will give us a new prevalence number. So we'll have an answer to that, not only just to terms of numbers, but also hopefully by age group.
We were going to share a fact about that later this month for October too, but I think a good follow-up question to that, because I've asked you this question before too, is why is it important to know how many people are living with spina bifida in the US?
Well, everybody thinks that spina bifida is a rare condition. And in the United States, the definition of a rare condition is anything that has less than 200,000 people affected by it. And we know probably half of those people then at SBA, and that's rather unusual. So our sense is that it could be larger than we think. It may not be as small a number as we anticipate. It may be larger, but even beyond that, I think that the fact of the matter is, regardless, it helps to know if we're doing enough. If you don't know how many people there are, then it's really hard to know when your efforts have been successful. You know, we might know we're successful for X number of people, but is that really successful for everyone? And what we want to get to is successful for everyone, not just for a few. And so I think the big reason to know is you have to be able to know when you've hit your mark. And if we don't know how many there are, then we have no clue. So it just gives us a lot more information so that we can plan better and also probably actually implement better. So that's what our hope is.
Yeah, it really drives into our mission, which for those of you that don't know, is to build a better and brighter future for those living with and impacted by spina bifida. So it's just one of those things that falls in that bucket. Tim, I think I'll ask you this one. Someone asked, why is spina bifida often referred to as a pediatric condition, which hopefully it's not anymore. But if somebody hears that, why is that?
It's because too many people are ill-informed. The focus of SBA and the focus of care historically has been in the pediatric populations, and that's where kind of the innovations in care happened. When I went to medical school in the 1980s, the majority of people with spina bifida were children. There were very few adults. But with the advent of shunts in the late 1950s and early 1960s, the population of people with spina bifida were living into adulthood. And frankly, medical school training and training in adult specialties has not kept up with the idea that people with spina bifida and people with a whole variety of other conditions which present or have presented in childhood are living to adulthood. Most leaders in medical schools or leaders as department heads in family practice or general internal medicine are old geezers like me that learned about this when it was primarily a pediatric disease. And frankly, adult medicine has not kept up the pace, not just with spina bifida, but with a whole variety of things. So it's people who just have not recognized it. In fact, the majority of people with spina bifida now are adults rather than pediatric patients.
Yeah, thank you for that. I think that's a really good segue question into this question, which Sara, I know you will be able to answer this question and will like this question too. What, if any, progress has been made towards finding better healthcare for adults with spina bifida?
Well, that's a really complicated question, but the simple answer is not enough. But the better answer is there's things in the offing that we're really hopeful about, and I want to share some of those with you. One of the things that we spent the last few years doing is actually trying to conceive of ways in which we can actually improve adult care. We know that clinics, while they work with children, are not that successful in the adult population. Adult lives are a lot different than children's lives. And the single day meeting with all the doctors revolving around you is not really going to happen in the adult world like it does in the pediatric world. And so we really realized that we have to come up with other alternative ways to address this problem of the lack of adult care. And so there are a few things that we're working on, one of which is we're building a collaboration of a coalition of conditions such as ours that are going to focus on transition. And why do I talk about transition in relationship to adult care? Is because without adult physicians, kids can't transition to adult care. And so if we can use transition as a way to get the federal government engaged with us to try to find solutions to this problem, then we're much more likely to be successful. And we're not just looking at spina bifida, we're looking at hydrocephalus and other pediatric onset and congenital conditions to see if we can all band together and say, this is an issue we're all facing. All of our populations have a lack of care that understand about our conditions. And so help us to find the solution to this. So that's one of the things that we're going to do. And we've actually started building on that right now and hope to launch that in January of 22. Another thing that we're working on is how do we get to healthcare providers that are already treating people with spina bifida, the primary care physicians and family care physicians who really don't know that much, but they've taken a gamble and have somebody in their practice. So can we do something to educate them about spina bifida and give them resources and also support so that when they come across questions, they can get answers on a case-by-case basis? And we're going to start this project beginning next year as well, in which we're going to ask all of our constituents to tell us if they are seeing a healthcare provider as an adult. And if so, if they'll give us that contact information, then we're going to be reaching out to those healthcare providers to see if we can engage them in some training and also give them some supports that will help them so that when strange questions come their way, they don't just go, I don't know, and move on, but actually say, well, let me see if I can find out the answer to that, and let us help them find that answer. So those are two things that we're going to work on next year that I think will make a big difference. Beyond that, we're envisioning starting an actual training program for healthcare physicians who treat adults with spina bifida, in which there will be it's a telementoring program is what we're talking about, so that physicians can connect with the few adult specialists that we have in the country, get their questions answered on a case-by-case basis, and learn more about spina bifida. So that's one of the things that we're also thinking about. And we're still in the development of other ideas. We're also looking at going to the medical society meetings and doing trainings at those meetings, doing workshops or add-on workshops to those conferences to see if we can also reach physicians that way. So all of this is kind of where we're heading to go. And we think this will help to find and train physicians in how to care for people with spina bifida.
I see a lot of comments on our social channels as we stream this too, about where to find professionals or doctors who treat and see people with spina bifida now. Our network is kind of always growing in some ways. We're always learning about a new practitioner or maybe a clinic expanding. So I encourage you to check out our website and visit the clinic page on our website and see if there is anybody in your area that might be close to you who could see you if you are an adult with spina bifida. And if you have further questions or need further referrals, again, you can contact our National Resource Center.
I think the other thing too that we have to realize that with telemedicine, that things are going to change a little bit, because now people can see specialists in other states. And I think that as the legislature takes on the issues and CMS take on their issues around reimbursement and things like practicing medicine across state lines, all of those things, once those questions get settled, then I think telemedicine is going to have a big role to play in caring for our adults as well.
I agree. I hope so. I'm surprised at how many people are asking questions about age. The oldest person we know with spina bifida. Not that that's incredibly relevant, because we can all know a lot of people with or without spina bifida age, but if it is of importance to anybody, we did get to meet a person last year who was 92 with spina bifida, and she will be 93 this year. But I think that also goes to a good topic. Tim, a few months ago, you did the Aging with Spina Bifida webinar, the over 40. Would you mind just kind of giving a little, talking a little bit about what that webinar was about? And even you as an adult with spina bifida, why adult spina bifida, and a person who's a medical director and in the medical field, why that topic is important?
So I think the topic is important because the majority of people with spina bifida living are adults, and yet there is very little research on adults with spina bifida. The majority of research has been done on pediatrics through pediatric clinics. There is very little research that's happening, or has happened, I should say. More is going to happen, but I think it's challenging because what we know about aging with spina bifida is very anecdotal still, right? So what problems have people been having, whether that's joint pain from overuse over time, early onset arthritis, complications that are present in people without spina bifida but may happen earlier in people with spina bifida, such as obesity and secondary high blood pressure and heart disease. I worry, as I said, I worry personally a little bit because in my own situation, while I've really been thankfully and luckily very healthy, I worry about things like changes to skin elasticity that happen with age, and whether pressure sores are going to be more likely. I think it's a challenge I am personally struggling with, in that my mobility has changed, not because my spina bifida has changed, but as you get older, your muscles naturally weaken. Even if you work hard to exercise, they will be weaker, as you get into your 60s and 70s. And so while I have arthritis in my knees that limits me some, I'm also realizing that my mobility is changing, and that my adjustments in what I do in everyday life also are changing. And those are things that I can't necessarily totally prevent. So I think the challenge in adult care is that we don't know much about aging with spina bifida, and we need to learn more, and we need to get more data. But we also need to learn about the interface of spina bifida with conditions that adults can face who don't have spina bifida, whether it's type 2 diabetes, heart disease, high blood pressure, etc. So in adults with spina bifida, I think it becomes even more complicated, and therefore really important that SBA is working at the initiatives that we are to try to improve care.
Yeah, thank you for that. All right, I'm going to do a little bit of a transition, but I really want to know the answer to this question. So Tim, I think this one is for you. Michael, I see your question, and I think I read earlier that you were 36. Michael's 36, and he said his parents or him don't know what type of spina bifida he has, what level it's at, even at this age. And he wants to know if that is important. And if it is, who should he go see, or what type of testing should he do?
So I will say it's a little dependent on where you live and what resources might be available to you. I think a good physical medicine and rehabilitation doctor, we call them physiatrists or PM&R doctors, would be somebody that you could see, potentially somebody who's spinal cord injury trained as well. And they can help either through testing, an MRI or something to help be able to determine the specific type of spina bifida you have. And then they're also good at doing muscle testing and trying to figure out your functional level of muscle use to give you an idea of that.
Okay.
And that's usually a good place to start.
And again, the National Resource Center can help you find a place to find physiatrists in your area.
Yeah.
Right.
Yeah. Our National Resource Center is really the place for all things. So you can ask them anything, just like this event. There's no dumb questions to the National Resource Center. Okay, I think we'll do a few more. So if anybody has any more specific questions, feel free to ask. I'll try to go through some of these left on the list. Tim, we kind of get a lot of questions around this through a lot of our Q&As. So I'm going to let you decide how you want to answer this, but somebody wants to know what the relevance between a bowel obstruction and spina bifida is. And I think that could be a good way to just talk about maybe neurogenic bowel in general with spina bifida, especially for maybe people in the younger part of our community who might not be on that journey yet.
So the term neurogenic bowel is a term that we utilize in spina bifida, which essentially says that a segment of the bowel is affected by spina bifida, so that the nerves and what the bowel should do through the nerves is not working appropriately. In many individuals, that causes a tendency toward constipation and bowel accidents. And we do have regimens that we try to do in a variety of ways so that we facilitate people having bowel movements when they want to have them. And evacuating their bowel well so that they're not having bowel accidents when they don't want them. We want people to be successful at being out and about and doing things that they want to do and not worried necessarily about having bowel accidents. A bowel obstruction is slightly different. Constipation may contribute to that. But I often think of a bowel obstruction as something that bowel, we have different names for it. But a bowel obstruction, to my mind, while constipation may contribute to it, I don't know how frequently bad constipation is a cause of it. I often think of a bowel obstruction happening potentially because of scar tissue from abdominal surgeries like shunt surgeries or something like that happening. But a bowel obstruction is typically going to manifest by significant pain or discomfort and bloating. Now, again, your ability to feel that pain might be affected because if you have a very high level of lesion, you might not have great sensation about the area of the abdomen. But it may manifest by vomiting. Certainly, you're going to not be having bowel movements typically if your bowel is really obstructed. And if you're concerned about a bowel obstruction, to my mind, that's a reason to go to the emergency department. That can be a very serious issue.
That's good advice. When in doubt. All right, so we're kind of running a little bit low on time. I'd like to kind of keep these lives short so people can come in and out if they have to and get their questions answered. If your question wasn't answered live, I will go back and try to answer them with Tim and or Sarah later on. So just check your notifications if you're on Facebook. Sara, I kind of want to end with this question because I feel like this is really relevant and important to where we're at right now as an organization, and also like Awareness Month. Somebody asked about advocacy and that they have a hard time understanding why advocacy is so important for us as a community and like why they should get involved in it.
Sure. So advocacy is really important to our community because our community is not well understood. People don't really know what spina bifida is as a whole. They might have heard the name, but they don't know about the challenges that people who live with spina bifida have. And as we've just talked about during the past few minutes, there's a lot we don't know about spina bifida, about how to care for people, particularly as they age with spina bifida. And that's where our largest group is. So if we don't stand up and make noise, nobody's going to pay attention to it. There will be no dollars that come our way for this community to be able to do the research necessary to answer some of these questions. There won't be, our voice won't be considered in things like reform for Social Security or anything of that matter. And so advocacy is the way that we kind of stand up and start saying, pay attention to us, and start educating people, particularly those who make the decisions at the federal, local, or state governments, what our needs are. And if we don't tell them what they are, they can't help us to get those needs taken care of. So it's up to us to be able to say, we're here, we're important, and you need to pay attention to us. And this is why. And that's what advocacy gives us the tools to do.
Yeah. Somebody said last year after Teal on the Hill, I thought this was a really powerful tool, that right now they don't feel like they have anything to advocate for their child because they're just trying to take it week by week. But our mission statement actually made them realize that they do, because the goal is for them, for their child, to have a better and brighter future. And if we're not actively working on that now, then we'll never get to that goal. So even if you don't feel like advocacy affects you like today in the space in life you're at right now, in a way it does, because it's a part of all of our futures. So yeah, that was a good sum. All right, well, thank you all so much for joining us. Thanks to those who were able to deal with our technical difficulties in the beginning. I'm glad we were able to get Tim on the phone. And thank you, Sara and Tim, very much. I think people really appreciate, I know people really appreciate you guys being on these lives. So you can always reach out to us at SBA via our social networks, our website. We have forms on our website. Any of us, Sara or Tim, are happy to talk to you, happy to answer your questions. And we are grateful that you all chose to join us during Spina Bifida Awareness Month. If you haven't yet, a little shameless plug, you can get your Spina Bifida Awareness Bracelet. This is the toddler size now, so we have smaller sizes for people who want them. It is a great way just to be raising awareness all year round. And in Sara's note, it is a little bit of advocacy too, because people have to know us to know what we want. So I wish you all a very great rest of your October and Awareness Month. And thanks so much for everybody for joining us.
Bye, everyone.
Bye.
Bye, Tim.